Hello and welcome to Module 6. This is the last module in this course for the semester. The focus of this module is on research in informatics. The learning outcome associated with this module is to analyze trends in nursing and healthcare that promote informatics research. So as usual, we will discuss some of the concepts related to this topic, and then we will look at the module within the course so you can see the reading assignments and your assignment for this module. So first we'll discuss just informatics research and evaluation in general. So those that are functioning in informatics roles within healthcare facilities or organizations, in nursing, informatics specialists or informatics nurse specialists, you might see that abbreviated in this presentation as INS. They may conduct research into the design, the development, implementation, and evaluation of informatics solutions, models, and theories. Now, the ANA Informatics Scope and Standards says that INS researchers may use systematic methods of inquiry to identify, retrieve, represent, and evaluate data, information, and knowledge within informatics solutions and data repositories. So research and evaluation functions listed here, again, are from the ANA Informatics Scope and Standards. This is certainly not an exhaustive list, but gives you some idea of the types of research that is commonly conducted among those that are working specifically in informatics, whether they be an informatics nurse or they're some type of informatics nurse specialist. So there may be research that's done in concept or symbolic representation of nursing phenomena, evaluating clinical decision making in nursing. This type of thing actually benefits us because we have lots of clinical decision support systems now. It's very important to understand how nurses are thinking and how we can develop systems to help them in those decision-making moments. Applied informatics research and assessment of the use of health information tools and resources by consumers and interprofessional team members. Evaluation of effective methods for information systems implementation, acceptance, and utilization. User experience research about the design of systems and the impact on the consumers, the nurses, the interprofessional providers and their interactions. And we see a lot of this user research done with mobile devices these days, the sensors, that type of thing. Evaluation research about the effects of systems on the processes and outcomes of care and customer satisfaction. Usability testing of nursing and consumer applications. Evaluating how consumers use computerized healthcare products. Research concerning clinical vocabularies, and we've talked about standardized terminologies and vocabulary in this course, and the impact that has on all of us. Consumer communication and usage of technology-based support groups. So this, again, is not a comprehensive, exhaustive list, but these are some specific examples of the type of research that those in informatics might be working on. Now, research in nursing informatics may span a range of activities, including exploratory research. This includes data mining, for example, experimental research, process improvement, and informal evaluation. And INS, or an informatics nurse specialist, working in research and evaluation, might conduct research projects to develop and to refine standardized nursing vocabularies, as again, once we talked about that, or to link nursing interventions to outcomes in large data sets. This work may include evaluation of organizational attributes for successful adoption of documentation systems, or perhaps the impact and efficacy of hardware or software solutions. So again, this is information that the ANA Scope and Standards, Informatics Scope and Standards is providing. Now keep in mind that nursing informatics research may also incorporate this consumer orientation through the study of nurse-consumer interactions, or how people are working in web-based areas, or interactions with web-based platforms. They may do this with older consumers, or they may look at how this is impacting nursing workflow. They might look at patient reactions to things like instant messaging. There are numbers of examples that could be provided for this type of thing. Now, I do want to mention, as your book, the reading in your book points out, that there are obviously different approaches to research. The quantitative approach versus the qualitative approach. And you will learn much more about those general approaches to research in your coursework as you progress in the program. And then there's also mixed methods. So it's also noted in your reading in your book that technology is really key and fundamental in supporting the data collection, the data management, which you all have certainly talked about again in this course. So it's sort of fundamental to the things that we do. But among those different research methods or traditions, again, you will learn much more about those, and certainly see how technology works to support that. Now, in orientation, so a while back, we talked about, just briefly, the trends in informatics research, just to give you all an idea about the types of things that are being discussed among those that are in different work groups within nursing informatics, that are agendas, part of agendas that are set forth by credible authoritative groups within this specific specialty area. There's a work group within the AMIA, which is the American Medical Informatics Association. It's the Nursing Informatics Work Group. They work most of the time yearly to produce some sort of publication, some sort of presentation documenting the research trends within informatics. So this is an example of the findings that they published in 2016. This was in Computers Informatics Nursing Journal, and they had multiple phases, as you can see here, and they identified 38 articles that were specifically about nursing informatics. They determined the journal publication frequency, the research method used, the research setting and focus. They also analyzed those articles, those publications that were recommended by members of the work group that informed member scholarship. So they explored within the databases and then among each other what had influenced their work. This is the table, the results of their literature, what they found in the different databases. And I know you're familiar with those databases. And they found that EHR and clinical systems remained a focus within this body of literature, which makes a lot of sense with all that we do with EHR. Public health, community setting, mobile, and e-health were emerging areas of research, again, not surprising. And then qualitative research is predominantly used. This is consistent with the early stage of the specialty. So there are many things that we don't know a whole lot about because it is so new. It's emerging, a burgeoning field here. So with that, qualitative research is often most appropriate because we don't know a lot. We don't have a lot of scales or instruments to measure certain things, so therefore qualitative research is often used. So that was sort of a summary of their findings. We also have, this is another group. This is the New England Nursing Informatics Consortium. They did this in 2017, analyzing the body of literature related to nursing informatics. They sort of broke down the characteristics of the research that was available. You can see the different settings that they noted: ambulatory, community, public health, continuum care, health professional, expert panel, hospital, long-term care, other, and then not applicable. And you can see the majority of the literature, and this was from 2012 to 2019 overall, but the majority of this is related to research that has been conducted in a hospital setting. They also identified themes, just like the other authors, that they discussed clinical decision support and clinical documentation still being a focus. And again, that's related to the EHR once again. Patient empowerment and self-care was another theme. Technology acceptance by patients, and they specifically saw portals, telehealth, and mobile applications in that literature. Telehealth standards was another theme. Social media was lacking in the data. The use of telehealth to address health disparities and access, patient-reported data, patient being recognized as a stakeholder, big data is another theme that was identified, and then interprofessional care coordination, and shared decision-making. This was a project that I recently worked on with a colleague in Slovenia who is a computer engineer who does bibliometric analyses in lots of areas in nursing. But we worked on this project to look at the content demography, comparing nursing informatics and medical informatics scholarly publications. And you can see we had, in our results, there were many more medical informatics manuscripts or articles that were available versus the nursing informatics journals. And we really just took the two top informatics journals within the field of nursing. The first one being Computers Informatics Nursing. It's specifically related to nursing informatics, and then the Online Journal of Nursing Informatics, which is a journal that's owned and managed by HIMSS, which is the Health Information Management Systems Society. So those two journals are specific to nursing. There are other medical informatics journals, but these two, the International Journal of Medical Informatics and the Journal of American Medical Informatics, are very popular, high impact factors, and so that's why we chose those 4 journals. But you can see just from the color coding, I know you can't really read the content that's on there, but the color coding over here, it links to these themes identified. In medical informatics, the themes include health informatics for self-management. So these are mostly physicians, healthcare providers that are publishing in these journals. So they also talked about or discussed diagnosing and classification with machine learning, EHR, terminology, documentation, interoperability, and the decision support systems. Where nursing informatics, the themes that fell out were nursing informatics education. And, you know, there are a lot of people in academia that write articles related to education in nursing, patient portals and self-management, e-health and e-health literacy, information and communication technology and patient safety, meaningful use in mHealth, and then technology acceptance in nursing care. So they were different perspectives. You can clearly see that was found in the literature. So these, again, are just examples of how we can explore the specific body of literature related to informatics and begin to see how the outcome of the publications, the results that are being disseminated, how that compares with the agendas that are set forth, and just the trends related to the emerging technologies we see being implemented in patient care areas. So we're going to speak a little bit about emerging technologies as well. So I'm going to hop over to the course and discuss what's in Module 6. So your reading assignments are here, chapters 47 and 48 in Sabin McCormick. Again, I have the PDF notes from, or the notes pages from the author, or the editors rather, and then these are the articles. Now there are a number of these. Most of these are just related to different emerging technologies that are available, and I just wanted to share these with you because you might find that some of these technologies would be appropriate for you to use in your research with your patient population, or your population for your research. So the first one, though, is another summary of research trends. So the first article is Trends in Publication of Nursing Informatics Research. So again, this is just another example, and this is that same group that I spoke about before, the Nursing Informatics Work Group at AMIA, and how they went about reviewing the trends in publications for informatics research. The next article in your list is related to remote monitoring. So this is, there are a couple of articles here about sensors, a very popular way of collecting data. So you can review that. And there may be, some of these may inspire you in some way as you think about what you want to do with your research. This one is related to remote monitoring for total knee patients. This article is related to health information exchange using smartphone technologies. There are some articles in here related to the cloud, cloud computing, and this one is another article related to passive monitoring of patients. And again, feel free to peruse these and see, which ones, resonate with you and what you plan to do with your research. This one is related to surface computing. That's another sort of emerging area that is being explored in terms of its application with patients and how we are sharing information with them and how they're interfacing with us. So this is an article about the cloud and storing data on the cloud. And the cloud is certainly cloud computing can deliver services to our healthcare organizations, helping us better serve patients. And there's a lot of scalability there, a lot of space sometimes, and it's quite helpful. There were lots of concerns early on about security. Those still exist, but there's been a lot of advancements in that area to sort of help ease our mind with that, with regard to that. There are a couple articles related to simulation, and for those that work in education, you know that we use a lot of simulation in education. There's also more and more simulation being used in situ in healthcare facilities. So this, again, another emerging area where technology is involved for sure. "3D printing is another emerging area that is being explored in all kinds of ways, so feel free to review that. Robotics is another area that is really kind of wide open in nursing. There are different areas in the world from a global perspective that have really started to explore the use of robotics in direct patient care. We don't necessarily see that in our part of the world and within our country, but there are other ways in which we are integrating robots into patient care. So this article is another article related to robotics, that last one. Now, I wanted to point out to you, just for your information, that the NLM, so the National Library of Medicine, which is part of NIH, has a list of mobile applications and websites optimized for mobile devices. So these are very helpful. Some of them certainly designed for patients. And then there's even the PubMed for handhelds, which is helpful. And Yale University has a very nice list of mobile device applications, some of which you might be familiar with if you are a provider, a healthcare provider. Some of these may be using in the clinical setting to help make decisions. So feel free again to review those. And then as far as your assignment for this module, you would just be participating in the video seminar, and it's module 6, video seminar presentation, and just share with the group how you think informatics can help with your research. Consider the new and emerging technologies that might support your recruitment, your data collection, your data storage, your data management, data analysis, and reporting. So we've talked about a lot of things in this course over this semester. And there's a lot more we can certainly talk about. If you choose to take the courses in the technology cognate, you'll learn much, much more about big data, data science, data visualization, and then much more about these emerging technologies as well. Please feel free to ask any questions of me. I'm happy to speak to you. I've certainly enjoyed working with each of you in this course, and I'm very excited to see how your research projects evolve. And again, just contact me if you have any questions.